In a world where lungs just want to breathe in peace, one chef dares to ruin everything. Today, our host will attempt to craft something so sticky, so gloopy, so medically concerning, it sends the alveoli straight into panic mode. Welcome to Cooking with Jess, the cooking show nobody asked for. Hold on to your stethoscopes. Things are about to get moist.
Welcome back to Cooking with Jess. Today we're making something sticky, slimy, and absolutely terrible for breathing, pneumonia. This is your normal alveoli. It's supposed to be filled with air, but today we're filling it with fluid. Then comes bacteria and virus, the troublemakers. In response, your body produces white blood cells, which are supposed to help, but instead they actually hurt, and you get stuff like pus and inflammation. Then comes mucus. This is what makes your cough productive and worse. Then comes consolidation. In this, the alveoli get stiff and sticky and can't exchange oxygen. Now we're going to mix it all up. After mixing all the fluid, bacteria, pus, inflammation together, this is what we get, pneumonia.
As the slime thickens, healthcare providers begin their investigation, like CSI, respiratory unit. First up, the chest X-ray, proudly displaying those cloudy white infiltrates. It basically screams, "Congrats, your alveoli are drowning." Next, the sputum culture, where we find out which microscopic gremlin caused this disaster. A CBC checks if the white blood cells have decided to show up to work today. And a pulse ox reveals if your oxygen levels are vibing or violently dropping. When all signs point to slime domination, the diagnosis is clear. Pneumonia has entered the chat.
Now, let's fix this sticky mess. We give oxygen, encourage deep breathing, increase fluid, elevate the head of the bed, and use an insanative spamometer to open up those stiff lungs. If your pneumonia gets worse, it can cause stuff like respiratory failure, sepsis, pleural effusion, and lung abscess. To prevent pneumonia, you want to wash your hands, get your vaccines, stop smoking, and manage chronic illness.
You thought I was done telling you about this respiratory disaster? Well, no. Now we have to talk about the medication to clear those lungs. To defeat this respiratory goo, doctors reach for the ultimate weapons: antibiotics. These medications march in like, "Step aside, slime, your time is up." Common choices include azithromycin, ceftriaxone, and levofloxacin, also known as the squad. But beware, they come with side effects, a bit of stomach drama, maybe some bathroom choreography, and if you're lucky, absolutely no allergic reactions. And remember, patients must finish every dose. This is war, we don't let the slime win. Okay, I know you missed me and back. Lastly, now that the battle has begun, it's time for patient education. Because pneumonia doesn't go away with good vibes alone. Patients should drink plenty of fluids to thin out the lung goo, rest like they're training for a sleeping Olympics, and avoid smoke like it's their toxic ex. Using the incentive spirometer is crucial. Yes, the weird breathing toy everyone ignores. And finishing the antibiotics? Non-negotiable. Oh, and if they start feeling worse, more fever, more slime, or more "I can't breathe," tell them to seek help immediately. Lungs are fragile, okay? Welcome to the Pneumonia Challenge. Question 1. Which of the following is a late sign of pneumonia? Is it A. a low-grade fever. B. A productive cough. Cyanosis, or D. Fatigue. You have 60 seconds. Think carefully. Early signs are cute and innocent, but the late signs, those are when the lungs start sending distress signals. Tick-tock, tick-tock. And the correct answer is C. Cyanosis. Because when the lips turn blue, the alveoli are done playing games. Question 2. Your patient has an oxygen saturation of 88%. What do you do first? A. Notify the provider. B. Apply oxygen. C. Start IV fluids. Or D. Collect a sputum culture. You have 60 seconds. Remember the sacred nursing law. ABC, airway, breathing, circulation. When oxygen drops, the lungs do not care about your other tasks. Choose wisely. And the correct answer is B. Apply oxygen. Because if the patient can't breathe, nothing else matters, not even charting. Question 3. Who is most at risk for developing pneumonia? A. A 25-year-old athlete. B. A 40-year-old non-smoker. C. A 70-year-old with COPD. Or D. A healthy teenager. 60 seconds on the clock. Think about age, chronic illness, lung function, and who has lungs that are just tired of life. Correct answer, C. A 70-year-old with COPD. Because when age and chronic lung disease team up, pneumonia walks right in. Question 4. Which statement shows the patient actually understood teaching about pneumonia? A. I'll stop antibiotics when I'm feeling better. B. I'll drink plenty of fluids to thin my mucus. C. I don't need the flu vaccine. Or D. I should stay in bed and avoid deep breathing. You have 60 seconds. Think about hydration, airway clearance, and who is about to fail discharge teaching. And the correct answer is B. Drink plenty of fluids. Because hydration is the only thing that makes mucus pack its bags and leave. Final question. A client with pneumonia has fever and crackles. What is your priority nursing action? Torture. Give antipyretics. B. Encourage deep breathing. C. Start oxygen therapy. Or D. Offer a warm blanket. This is your last 60 seconds. Use your nursing instincts. Channel your inner Hesse warrior. And remember, the lungs always want attention first. The correct answer is C, start oxygen therapy. Because without oxygen, those alveoli are clocking out permanently. And that brings us to the end of our pneumonia game show. If you got all 5 questions right, congratulations, you've earned your prize. What prize, you ask? Well, you didn't think I was going to let you play this game without a prize, did you? And if you didn't get all 5 right, go ahead and close your eyes for this part. Your lungs aren't ready. For the scholars who aced all 5 questions, enjoy these exclusive, never-before-seen photos of our host surviving real pneumonia.
And that's how you make pneumonia. Sticky, slimy, and terrible for breathing. Take care of your lungs or they could come out just like this.